The country could face another major vaccine stockout by mid this year if the government does not meet its financing obligations, which will impact the health of millions of children in the country. The Kenya Women Parliamentary Association, KEWOPA, the Health NGO network, HENNET, and other stakeholders have raised concerns over delays by the government of Kenya to pay the required 1.2 billion shillings required under the Global Alliance for Vaccine and Immunization GAVI agreement to procure the vaccines needed in the country. They have now called on the Ministry of Health and the National Treasury to take immediate action to fulfill this obligation.
Kenya has made significant strides in child health over the years, this largely attributed to improved immunization coverage. However, the gains could be eroded if Kenya does not meet its financing obligation. Kenya was by March 30th this year supposed to pay 1.2 billion shillings as part of its financing obligation under the agreement with the Global Alliance for Vaccines and Immunization GAVI. The delays could, however, see the country face a major vaccine stockout by June this year.
When we meet our part of the obligation, then GAVI will release the bulk of the money for the other vaccines. Now, what does this mean? It translates to about 6 million doses. So what this simply means is that if we do not pay our obligation, 6 million doses will not come into the country. So we are talking probably over 6 million children missing essential and life-saving vaccines.
Women Parliamentary Association KEWOPA, the Health NGO network HENNET, and other stakeholders have raised concerns over the financing delays by the Kenyan government under the GAVI agreement, noting this could compromise the health of children in the country.
The very real threat of vaccine stockouts that will directly impact the health of millions of children across the country. We issue an urgent call to the Ministry of Health and the National Treasury to take immediate action to fulfill this obligation.
And we want to make sure that no child misses immunization at the right time. Now, HENNET has been very, very active in that space with all the over 100 NGOs that, and civil society bodies that are its members in making sure that we lobby government to put a good amount of money for us to be able to be self-reliant when it comes to immunization.
Speaking during an awareness forum, KEWOPA said it remains committed to ensure vaccine equity and access to all Kenyan children.
As a government, we should also put our efforts there so that we budget for this, where instead of just depending on the outsiders to support us, because they support us today and tomorrow they pull out, and when they pull out, then the question is what will happen to our children. So for me, it is the best thing we can do is to push and put this in the budget so that our young people can be well protected.
With the June 30th, 2025 deadline fast approaching, stakeholders have urged the government to meet its part of the immunization budget for the upcoming 2025-2026 budget cycle. While Kenya has co-financing plan with GAVI for the next 4 years, the country is supposed to fully transition to full vaccine financing by the year 2029, having acquired the status of lower middle income economy.